Welcome. We're so glad you're all here today on this sunny day. I am thrilled to be joined by colleagues at the Geiger Institute to talk to us about our data. We've done a project together for a couple years now, and they've been analyzing the homicide data that JDI has been collecting and talking to us about recommendations that come from that learning and what the data shares about what is happening in Massachusetts and what could be happening, which is the most exciting part. So I'm thrilled that you are all here today to listen to this, to walk through this with us, and so grateful and honored to our friends from the Geiger Institute for their hard work and really their round-the-clock dedication to this subject across the country. And so I'm going to turn it over to my friends here. I think you can all see slides. We're gonna do this. We're gonna little process here. We're gonna do hold questions for the end. We do have plenty of time for that. So you can feel free to drop questions in the chat. We'll keep an eye out for those. If there's something that's like you cannot continue listening unless you hear the answer to the question, like a clarifying question, we will interrupt. So we'll get that answered. Otherwise, we'll answer questions at the end. So feel free to drop in the chat who you are, where you're coming from today, and any questions that pop up along the way, and then we'll go through that at the end. Does that sound good? Yeah. All right. I'll turn it over to the Geiger Institute, friends.
Thank you, Greta. Thank you so much. Um, we're happy to be here with you all today, giving you a little information about what we've learned, having gone through the Jane Doe data, and really we're going to contextualize that against some of the national data here, but most importantly, really hopefully think together about what is that data telling us about preventing these homicides in the Commonwealth. Most of you know me from my work at GD Geiger over the years, but I am now taking a role strictly with the Geiger Institute as the executive director. The Geiger Institute remains a division of the Jeannie Geiger Crisis Center, but really focusing on our national training and technical assistance work. But our work here today is really going to be focusing on what are the key statistics and patterns that we've learned from looking at the Massachusetts data? And we're really interested in what you're seeing and what you think about the data. And really, what is the state of data collection and what might be the next steps to really using this data to leverage better prevention efforts here in the Commonwealth? So before we go too far, I told you who I am, Kelly Dunn. I've been at Jeannie Geiger Crisis Center for coming up on 30 years here soon, but and now having transitioned to a full-time executive director of our national work at the Geiger Institute. But you may not be as familiar with my colleagues, so I'll let them introduce themselves. Sarah?
Thanks, Kelly. With that 30 years, you're always a tough act to follow. But my name's Sarah Galgano. So thrilled to be here with you all today. Thank you to our friends and partners at JDI for extending this opportunity. I am a senior project specialist with the Geiger Institute. I've been with the Institute for about 5 years now, where I support implementation and lead implementation, I should say, of our intimate partner homicide reduction efforts at the local, state, and even a federal project we're currently working on. I also bring a lens of data to our work, so really focusing on fidelity of implementation and understanding the impact of our initiative on addressing this very significant issue in communities. So, lady?
Hi everyone, my name is Olivia Alvarez and I am an associate project specialist here at the Geiger Institute. Truly a pleasure to be with you all today. My background is in providing direct services to survivors. I've been with our agency for over 5 years now, and just as Sarah, I also implement the DBHRT and the DALE nationally. Thank you so much for having us. I'll pass it over to Kelly again.
Thank you, guys. So, The Geiger Institute, like I said, it's a division of the Jeannie Geiger Crisis Center, where the Crisis Center is obviously focused on services up in the North Shore area, and the Geiger Institute really has a national focus. So we're always thrilled when we can do work here in Massachusetts. We were thrilled to be called in to do some work on this project. It is our great pleasure to be doing some work locally, and very rewarding for us to be looking at Massachusetts data when we're often looking at data in other states like Texas or Ohio. But I think what that also allows us to do is really contextualize the Massachusetts data with some of our national work. So we'll be doing a little bit of that today. So the Geiger Institute has a pretty ambitious goal to reduce the rate of intimate partner homicide on a national level. We do that in a couple ways. First is bringing our Dale and DVHRT approaches to communities across the country. Our goal is to get them out to every community that wants them. Um, Most folks are familiar with the DVHRT model. You may be running DVHRTs or several DVHRTs locally. You may be less familiar with our Dale approach. The Dale is an 11 question police administered risk assessment instrument that we developed and co-own with Dr. Jacqueline Campbell out of Johns Hopkins and Jill Messing out of Arizona State University. It identifies victims at highest risk of lethal or near lethal violence. And then there is, most importantly, a protocol that goes along with it that informs victims of their risk level, connects victims to services immediately through a partnership with law enforcement and the local DV program, and then brings that risk information to the court to inform bail and bond proceedings. Cases identified through that Dale tool are then often the cases that move on to the local high risk team for longer term risk management. We've got about 90 communities using that Dale risk assessment tool across the country. Our first implementation being in the city of Cleveland, and our largest implementation to date being in the city of San Antonio. In addition to those Dale and DVHRT approaches, the Institute is also focused on elevating community solutions. We know this is a complex issue. Preventing intimate partner homicide is not an easy task. So in addition to Dale and DVHRT, looking to incubate, assist, elevate additional community-based solutions that are being developed around intimate partner homicide. And then the last sort of prong of our approach here is improving quality of data and research around intimate partner homicide. And this is really where it was a perfect combination for Jane Doe's needs in really looking at the data in Massachusetts. What's the quality of that data? How could we improve it? And what is it telling us? I really think it's time for a national conversation about improving the quality of data nationally around the issue of intimate partner homicide. And we'll talk a little bit more about that when we go on, but we're hoping to really help elevate a national conversation about that at the Geiger Institute. So before we go too deep, let's look at the prevalence of this issue of intimate partner homicide that we're going to be looking at today. Here's some good news. Massachusetts ranks 46th in the US of the number of females murdered by males in single victim, single offender homicides. So there's a couple of caveats here. I think most importantly, what I want you to take away from this is we have one of the lowest intimate partner homicide rates in the country, which is something for us to be very proud of. We'll talk about some reasons why we think that might be at the Institute, and we're interested in hearing your assessment. But even this statistic I have in front of you has many problems. So this is from the Violence Policy Center. They actually stopped doing a ranking several years ago because it's just not a perfect match, right? We know number of females killed by males in a single victim, single offender is not going to capture all of the intimate partner homicides. There's just multiple problems with the way data is collected, the inconsistency across states that almost makes it impossible for us to properly rank the states on their rates. So, I mean, that just drives home to me the fact that we can't even give a perfect ranking of our states in some of the problems we have with this data set around intimate partner homicide. But even with that being said, all my caveats about the data, I do think we have a lot to be proud of here in the Commonwealth with one of the lowest rates in the country. We know that when a female is killed by homicide, about 50% of the time, it's her partner or former partner. We know that when a male is killed, about 9% of the time, it's a partner or former partner. So when we're talking about intimate partner homicide specifically, we are sort of overwhelmingly talking about female victims, but obviously not exclusively. So, what does that mean for Massachusetts? So, this is Jane Doe's count. There were 34 intimate partner homicide related deaths in the Commonwealth in 2024. This is one of the data sets that we looked at. What does that mean? That means about every 11 days, we have a life taken due to domestic violence. And you will see, and I would say to pay attention to the phrase, the wording here. So, here we're talking about intimate partner homicide related deaths. This to me is the proper count. This is the primary victim, if there are children killed in the domestic violence incident, if the new boyfriend is killed, trying to intervene, really the totality of lives lost to domestic violence, which is the way Jane Doe has structured their data collection. So that is one life every 11 days here in the Commonwealth. This is the last victim, Diane Opper in Belchertown. She was shot and killed by her husband, who is saying that the gun discharged and he had killed her by accident, but he has subsequently been charged with murder in her death. This is still pending, so obviously we don't have confirmation of a guilty finding here, but this appears to be the last victim of intimate partner homicide, and it was just, you know, I don't know, 15 days ago, something like that. I will tell you, this is always daunting to us because every time we put a presentation together, we always try to pull the last victim of intimate partner homicide. And it is not uncommon that we pull this presentation and within a day of actually delivering it, we almost always have to update it in any state that we're in. So why look at these homicides? You know, we would argue at the Institute that every death is really a call to us to examine the systems that are set up to protect victims. And to not do that, and to just go back to business as usual when we've had a domestic violence death, to us is to not hear the calls of that victim, to not hear the cries of that victim. So we really think every life lost to domestic violence really calls us to look at the circumstances of that homicide and to ask ourselves the question of what was the connection with the systems that we set up to help protect victims, and what could we maybe have done differently in this case? And really, we think it is the lessons learned from those homicides that really helps to improve our system. There's often, you know, an opportunity for changing the system response following a homicide. So really being prepared to understand what the data is telling us, and when there's a homicide, to really do that analysis and to leverage that, you know, to close those gaps for future victims who are accessing those systems. I will tell you that is the exact way that the high risk team was created in Massachusetts. It was, you know, the lessons we learned from the homicide of one of our victims and really doing an analysis of that case that really helped us to figure out the system gaps. So we really think there's a call for that in each and every life lost to domestic violence. We know that most intimate partner homicides are preceded by escalating patterns of abuse. We all know that by now, right? We know that there are these risk markers we see in almost every case that ends in homicide. We see the same risk patterns over and over again. And at the Institute, we use the term domestic violence homicides are predictable and preventable. In fact, we would argue it's maybe the most preventable category of homicide. And it is because there are those risk markers. And if we can pay attention to those, identify what those are, and then leverage the system to intervene better, that's really an opportunity for preventing many of these deaths. So we're going to look
Great.
at what the data is telling us, both on a local level, and we'll contextualize some of that to the national level. Sarah, I'm sorry, over to you.
No problem, Kelly. Thank you. So as Greta mentioned, in 2025, we were fortunate at the Geiger Institute. Do you mind going back, Linz? Thank you. To partner with JDI to update an earlier independent analysis we had done of their Massachusetts data on intimate partner homicide. That original analysis looked at outcomes from 2018 through 2023. And through this partnership, we updated that data to include 2024, and additionally to summarize key findings from 2024. identify key historical trends for 6 years worth of data, 2018 through 2024, and then identify the limitations of our findings and develop any relevant recommendations to help improve data collection efforts moving forward. So, in this section, we're going to walk you through the 6 key findings that really emerged from our analysis of JDI's data. So, one of the first things we wanted to look at was the total number of homicide events that occurred in the state of Massachusetts from 2018 through 2024. And what we found, you can see on the graph here, is that those numbers really peaked and valleyed from a low of 10 in 2020 to a high of 26 in 2022. Over a 6 year period, there were a total of 127 homicide events in the state of Massachusetts. Now, I want to be clear that when I'm talking and using the word events, what I'm referring to is an incident that involved intimate partner violence where one or more people were killed. So the numbers on this graph don't represent the total number of people killed. They're the number of events where one or more people were killed in the state. Do you mind moving forward, Lind? Thank you. And that distinction between events and the number of people killed is important because we know that intimate partner homicide events often include multiple deaths. National level research tells us that on average, someone in addition to the current or former partner is killed in 1 out of every 5 homicide events. Such victims often include new partners. This is one we at the Geiger Institute have seen increase significantly in the data we collect over the past few years. Also includes children, family members, acquaintances, bystanders, law enforcement, and perpetrator suicides, which we'll talk a little bit more about later. And this is why intimate partner violence and intimate partner homicide is a significant public safety and public health issue, and not just something that occurs in the confines of the home or relationship. So when we looked at JDI's data, we found that there were a higher number of people killed than homicide events that occurred each and every year of our analysis. So from 2018 through 2024, as I mentioned, there were 127 homicide events, and there were 177 people killed in those events. Meaning, on average, for each intimate partner homicide event in the state of Massachusetts during that time, an average of 1.5 people were killed. Now, to put these numbers in context and compare them back against that national average of 20%, the percent of IPH events that involved multiple victims ranged from a low, though I will caveat still higher than the national average, of 21% of homicide events in 2021 to a high of 55% in 2024. The average number of times a homicide event included multiple deaths across the time period was approximately 38%, almost double that national average. So we talked a bit about the state level. We also wanted to further break down the data to look at homicide events and the number of people killed by county. What we found is that Worcester County had the highest number of homicide events at 23, followed closely by Middlesex County at 22, and Essex, Plymouth, and Suffolk counties at 13. Worcester County also had the highest number of deaths during this period at 34, followed again by Middlesex at 28 and Plymouth at 22. So again, to kind of think back to that national average of 20%, over this time period, approximately 48% of intimate partner homicide events in Worcester involved multiple deaths, 27% in Middlesex County, and a staggering 69% in Plymouth. So our first finding was really what's happening within the state of Massachusetts. To set the context for our second finding, we know that a perpetrator's threats to kill themselves is a significant red flag for lethality. If a perpetrator is willing to take their own life, they likely feel like they have nothing left to lose. And as I mentioned, many intimate partner homicide events involve the perpetrator killing a current or former partner and then taking their own life. Nationally, research tells us that about a third of intimate partner homicide events involve the perpetrator taking their own life. So that's that gray portion on the left graph on this slide. When we looked at JDI's data, we found that similarly, though slightly lower than the national average, more than a quarter of intimate partner homicide events in 2024 involved the perpetrator taking their own life after killing or attempting to kill a victim in an intimate partner homicide event.
Thank you so much, Sarah. So for the finding number 3, something that really stood out to us in the data was something very noticeable as a shift toward younger victims in recent years. When we look specifically at 2024, nearly 69% of individuals killed in intimate partner homicides were under the age of 35. And this is significant, right? Because it suggests how inter-partner violence is increasing and impacting younger populations, which may point to, maybe changing dynamics in the relationships or earlier exposure to unhealthy relationships, gaps maybe in prevention efforts for this age group. So it really raises that important question to all of us of, are we reaching and supporting those younger individuals before violence escalates to a lethal level? And I'm going to show you in the next slide the breakdown. It gives us more of like a clearer picture of how intimate partner homicide is distributed across age groups. When we looked at the data between 2018 through 2024, what we see is that these cases are heavily concentrated among younger victims and middle-aged adults. And in contrast, those cases involving older adults are less common. We see here that individuals over 55 account for 16 victims combined, and cases involving minors or those that were 76 and older were more rare. So it just reinforces how intimate partner violence homicide is more prevalent right now during key relationship building years. And it highlights the importance of that early prevention and intervention efforts. Go to the next slide. So for finding 4, we found how firearms were involved in a majority of intimate partner violence related homicides. And you will see it in the next slide as it shows the methods used in these homicides in Massachusetts. Shootings specifically accounted for 40% of the cases, highlighting how those firearms were involved in a majority of the cases. The next largest portion is stabbing. You can see it in the color gray, representing 33% of victims. And then the smaller portions, including strangulation, poisonings, beatings with and without objects, police shootings, arson, and other methods. And I'll kick it over to Kelly. I think you wanted to add something here, Kelly.
To say something about strangulation here. So there's some research that tells us that even if a victim is killed by another method, ultimately, say they are killed by a gun, they are likely to have been strangled in the year prior to whatever method they are ultimately killed by. So to me, this again points to prevention efforts. If we can improve our response to strangulation, it is a very strong intimate partner homicide prevention approach. So identifying strangulation, training officers to document strangulation, training hospitals to properly document strangulation, all of that across all of the systems, response to strangulation, including improving the advocacy response to strangulation, really to me is a strong homicide prevention effort. So even though strangulation is 6%, all of those victims who were ultimately stabbed or shot were likely to have been strangled in the year prior to that event.
Thank you. We can move on to the next slide. So just continue to talk about firearms and lethality. When a gun is present in a house with domestic violence, a homicide is 5 times more likely to occur, according to research. We've seen over and over how gun ownership is such a significant risk factor for lethality. And nationwide, a firearm is the weapon of choice in 53% of intimate partner femicides, which in Massachusetts is 55%. So we're very close to that national average.
Great. Thank you, Salady. So our fifth finding was that there was a significant amount of information missing in the JDI data set about the race, ethnicity, and birthplace for victims of intimate partner homicide. So this finding is unfortunately less about what we could look at in the data and falls into that kind of recommendation bucket. What we found is that only 6% of cases in the data set included information about the ethnicity of the primary victim. 18% of cases included the race of the primary victim, and 12% had information about whether the primary victim was US or foreign born. And understanding the extent of racial and ethnic disparities is critical to informing targeted prevention efforts. National research tells us that these disparities exist, with Black and Indigenous women killed at rates 3 times higher than white women, and Hispanic women murdered at rates 1.2 times higher than white women. Further, and I think this is a very important caveat, these national statistics are likely to highly undercount the true extent of disparities because we aren't able to ask homicide victims to self-identify their race and ethnicity. Instead, we often have other system actors assigning such demographic information to them. We also know that immigrant and refugee women face multiple barriers to leaving abusive partners and getting services, which puts them at a higher risk for intimate partner homicide. A study from New York City found that foreign-born status was the strongest predictor for intimate partner homicide. And in Massachusetts, a study found that foreign-born women were twice as likely to be killed by an intimate partner than US-born women. So while we didn't have enough data to look at IPH victimization in JDI's data set by race and ethnicity, there are some studies that have been able to do so. One study that looked at the characteristics of 340 intimate partner homicides in the state of Massachusetts between 1994 and 2014 found that Black victims were 4 times more likely to be killed by an intimate partner than white individuals. Now, underscoring the true extent of this disparity, 10% of the population in Massachusetts identify as Black, according to the US Census Bureau's 2025 Quick Facts, while more than 78% identify as white only. Additionally, that same study found that Hispanic, Asian, Alaskan Native, Pacific Islander, and foreign-born individuals were twice as likely to be killed in an intimate partner homicide event. Again, the Census Bureau helps contextualize the extent of these disparities as well, with 14% of the population in Massachusetts identifying as Hispanic or Latino, slightly more than 8% as Asian, and 18% as foreign born.
Our analyses also showed some other part of critical information missing, specifically prior contact with the system. This is specifically important, and I'm going to show you in the next slide some of the data that we found. Having data on prior system contact is crucial because when we look at national research studies, These have shown that many victims of intimate partner homicide had contact with the domestic violence response system, specifically law enforcement, prior to the homicide. And these numbers vary based on the location of the study or the research design and the length of the time that was reviewed prior to the homicide. But in New York City, specifically in a study made in 2021, 39% of victims and perpetrators had prior history with New York City police officers at any time prior to the homicide. A study made in Georgia in 2015 showed that 80% of victims had contact with law enforcement as well within the 5 years of the homicide. And on the higher side, for Houston in 2019, 91% of victims in a data set that was reviewed had been in contact with police in the 3 years prior to the homicide. So, what this information tells us is that many of these cases are being known to the system, are touching the system prior to the homicide, and this prior contact, right, presents those opportunities to intervene in these cases. So, having this data is extremely important. And we can move on to the next slide, Linz. At the same time, it's important to know that not every intimate partner homicide victim had that prior contact with law enforcement or the system. And to be able to improve those prevention efforts, we need data both for those victims that had contact with the system and those that didn't, because we want to make sure we have that information so that we can create alternative pathways to safety for victims who may not necessarily want to engage with the system. What?
So, Hema and Greta, no, this is a big one for me. I'm constantly ringing this bell. I would love to be able to get our hands around this data in Massachusetts so we could truly understand who is having prior system contact in the year or the years prior to being killed. I really think that would really allow us to have a more targeted prevention efforts here in the Commonwealth. So we are really interested at the Institute in making the system work better for those that are accessing it, especially victims who are at very high risk, and also knowing who is not accessing formal systems and how can we create pathways to safety for those survivors. So I don't think it's an either and. I think it's we have to really approach this topic from both of those positions. But right now, at least in Massachusetts, we don't have good data understanding who's contacting the system in the year prior to their homicide. Some other things that we think are relevant in Massachusetts. We talked about the gun laws, and I see there's some folks on this call, and we're gonna hopefully have time to open up the line. We'd love to hear your thoughts on this, but we do have everything's relative, right? So relative to other states, we have pretty more restrictive gun laws than lots of other states, which I think is playing out here in our lower rates of intimate partner homicide. So Lady showed you the data. It was about 55% of intimate partner homicides are with a firearm. In some states that we've worked in, Ohio and Colorado, for example, we see that upwards of 80%. Massachusetts tends to track very closely to New York, where strangulation and stabbing are often very close as the number one and number two method of killing. So I do think that is something that's impacting our lower homicide rates. And I also really have to talk about dangerousness hearings. Most of you on this call know that a dangerousness hearing allows Massachusetts after a hearing where the defendant is represented by counsel to hold an offender or a defendant pre-trial, so before they've been found guilty of a crime, if they've been found to be dangerous to an individual or to the community. We didn't even understand that other states don't have anything like this when we started working outside of Massachusetts. We went into, I think New York was our first state we worked in, and sort of said, great, well, what does your preventative detention statute look like here? What do you call it? In Massachusetts, we call it a dangerousness hearing. And they were like, we have no idea what you're talking about. And so it is very, there are a handful of states, but I think Massachusetts is probably the state that is using dangerousness hearings with domestic violence cases in particular, maybe the best in the country, at least as far as we've found. We haven't worked in every state, but we just wanted to call that out because we do think that is a very specific statute that we have here that we're using well. I do think it's important that it's not overused. You're talking about holding an offender pre-trial, but I do think this combination of a really good evidence-based risk assessment tool that tells us which cases are likely to escalate to lethal levels, combined with our dangerousness hearing statute, is a really powerful intimate partner homicide prevention statute. I would also say that, the dangerousness hearings often happen in that 3-month post-separation period. We know that's the exact danger window that the homicides occur, 3 months post-separation. So the time period of those two things align. So, what are some sort of areas for improvement here? There's some opportunities to improve the data. I think the real opportunity here, and Vilma, I was so excited to see you say, let's get together and talk about this, is to really reduce the siloed efforts. There's some really good efforts happening in Massachusetts around intimate partner homicides, but they're happening kind of in silos. And I think if we could bring those together, we could really have something more powerful. Making sure that we have several data sets around intimate partner homicide. One data set we talked to you about today, which is Jane Doe's data set, but there are other data sets. And how could we bring those data sets together really with an integrated analysis, particularly an analysis of those data sets with those closest to the issue, and really provide like a very smart integrated analysis of the data that we do have. And also our fatality reviews. Fatality reviews the point of a fatality review is to look at system contact prior to that homicide and really do an analysis of what could have been different. And so how can we leverage fatality reviews here in Massachusetts? I think fatality reviews need to work very closely with the coalition and with local DV providers, where we can really provide a victim's voice to an analysis of sort of the system response prior to the homicide. As we work in other states, we often read lots of fatality review reports. It's the first thing we do when we start working with a new community. We're like, if you have a fatality review report, send it to us. And I think there is often critical information in there, but it often sits on a shelf and it doesn't become live and actionable and parts of conversations and communities. And so we really need to, we think there's a lot of opportunity to leverage that. So our recommendations for improving the data set, particularly for Jane Doe's data set, is to document the source of the information. They're pulling from lots of sources to identify each one of their data points, and we think we would recommend documenting each one of the data set, the sources of their data, and also to see if we can improve these numbers around missing data sets around ethnicity, race, and foreign-born status. If we could improve the missing data around there, that would be really helpful. I think, lastly, this is the challenge or the opportunity here, and that we've got all of these really wonderful organizations. Jane Doe's been collecting this data for years and years and years. It is the only reason we know the full extent of intimate partner homicide in the Commonwealth, because they're counting not just the victim, but those corollary victims, those children, the new boyfriend that's killed in these events, right? We've got some wonderful work happening out of the Mass Women of Color Network. Their Keeping Black Women Alive report, really critically important work. We've got domestic violence high-risk teams, 26 across the Commonwealth, literally working with the most dangerous cases in the Commonwealth. There is a wealth of information there about what's working and what's not working. Leveraging the work of the fatality review and the great work out of the Department of Public Health that really maintains a very strong data set and has done some strong work around this. And the Governor's Council doing some great work around this in some of their committees. What would it be like if we could bring the data sets and bring those folks together to really do that analysis and leverage a strong plan for the Commonwealth? That's what we're calling for. And I think lastly, if we can get that better data, we can understand better who is being killed, under what conditions, what patterns are emerging over time, and really we can really get to those targeted, effective, and equitable approaches to make sure we're reaching everyone in our prevention efforts. Um, and so we were really excited to do this work with Jane Doe. We're really excited to continue it and to really think about leveraging more work here in the Commonwealth to even drive those rates lower here. But we'd love to open it up and see what you're all thinking about this. We know we've got a lot of expertise on this line, so we'd love to hear your thoughts.
Thanks, Kelly. Thanks all. I'm going to, Lindsay, can we stop the slides? Awesome. Thank you. And I'm gonna spotlight all of our speakers here. And Hema, did you have something you want to chime in? I'm trying to find your
Well, why don't
face.
we go for no, I'm glad to do a little wrap up, but would love to hear from folks here. Questions. We do have a good amount of time for some Q&A. So maybe let's go to that first. But this has been so very helpful. And we're so grateful for this partnership and to really dig into some of these recommendations that feel like consistent themes over many we know these things to be true about some of the data limitations in I think in so many places, and to really take advantage of the resources that do exist here in Massachusetts that really set us up to for success. And you know a lot of collaboration, a lot of interest and support around these issues. So it just feels like that last coordination piece is really what we can lean into for some good results. But yeah, let's take some questions.
Don't be shy. Please feel free to unmute yourself or raise your hand or drop it in the chat. Any of those work for
Those are my
us.
questions. We mean reflections, recommendations. You all are doing this work. Yes, so see Elizabeth's hand, I think. Yes,
Yep,
there you are.
yep.
There's your hand.
Yeah, thanks so much. Our team is here because we just thought this would be really interesting for us to hear what's going on. Thankfully, it hasn't directly impacted the survivors we've worked with, although we've worked with at least two who have died by suicide and related to the abuse that was going on. Like, we're 100% sure that that's what happened. What we don't know is, we don't know that there was a full investigation to be sure it was suicide, but let's assume it was, and it was due to what we understood working so closely with these folks, the ongoing abuse, bringing into court, losing, going into debt, all of that. And I know that isn't, I remember at the time asking Jane Doe if we could, how could we connect those kinds of deaths to the data that we're collecting. So just a gap. I don't know how big of a number it is, but it's something we definitely have felt. And we're a very small program.
So it's such a good point, and it's the 20th question on the danger assessment for a reason. The 20th question on the danger assessment is, have you ever thought about harming yourself, right? Because we know victims die from suicide is an outcome of domestic violence. It's a way out some victims take. So it's an excellent point. And I also want to say there is a growing body of training happening around what they're calling staged suicides. I find it really fascinating. One of our partners, Kelsey, is doing this work where they are finding a lot of these suicides are staged homicides and they're being missed all over the country. Which again, there's such an undercounting of these homicides. Like every data set we give you, we know it's undercounted. But this growing training around training officers better in responding to suicides and looking if it's a staged suicide and doing like a domestic violence investigation is a growing body of it's a growing area of training for law enforcement across the country. So it's really interesting that you mentioned, if they were suicides, because I think we're missing a lot of staged homicides.
Yeah, thank you both for the question and the response. Kelly. I saw Caru's hand up for a sec.
Oh, hi,
Yes.
Carew.
Hi, Caru.
Hi. Hi,
It's
Kelly. Thank you for your
good to see
team.
you.
This is great information. First, my question, will you be able to share this presentation? And my other question is in terms of um, survivor or victim of homicide who are born outside of the country. Were there any analysis of like, were there any contact with the law enforcement, with hospital, with DCI, like with all of the community agency at all? And then also my other question, if it makes sense, like what is the bystander role in this prevention? It's like in a small community in 5 years, I think in 5 years there was 3 homicides, right? All of whom are immigrants. Well, two, and then the other one ended up um, in that community. I think both of them connected with the bystander.
Hmm.
Um, yeah, so.
Okay, I'm going to try to remember your questions in order. I'm also dealing with like whatever muck everyone has in illness, so I'm sorry for my voice being a little raspy here. Um, so this is Jane Doe's information. We did this in partnership with them, so I believe that they're going to share it out to the coalition. So it's this slide deck along with a report that goes a little bit more in depth. Secondly, I'm going to throw it to Sarah. I don't believe we have a connection of the data set between prior contact and foreign-born status, but Sarah's really our data wonk. Was there anything on that, Sarah?
Yeah, unfortunately, you picked two measures we just simply weren't able to look at in the data, immigrant, status, or prior contact with the system, let alone examine them together. I think it's a really great point. We were hoping to look at some of those facets, but just due to limitations, weren't able to look at either.
And then last one on the role of bystander in prevention efforts. It's a great question. I mean, I think it would make for a great conversation with those groups that we talked about and sort of coming together and thinking about, that as one of the targeted prevention approaches is sort of, you know, training up bystanders around this issue. I think there's a question for JDI here. I'll read it to you, Hema. Could you speak to the process JDI uses to determine if a homicide in mass is a domestic violence homicide? Does JDI review all homicides and accidental deaths or receive reports from police departments?
Mm-hmm. It is a system in progress. I mean, really, what it looks like is largely a compilation of primarily media reports, right? That is the first point of contact that we really have in this. And we can share out, we do have sort of a homicide assessment protocol for membership, and we can. I believe that it exists in either our resources on Coalition Manager. We can drop it in for you. I think that there's a specific definition of what JDI considers to be domestic violence related homicide and sort of determinations around the relationship and the nature of the harm. It is not only based on police reports or friends and family interviewed, really. That is, I think, probably a level of the level of, I think, the sophistication that is being asked for here in so many of the conversations we're having today about really wanting to see that full context of the harm.
Mhm.
we are one of the few states, unfortunately, that is not formally part of a fatality review team as a state coalition. And that's really an opportunity to bring that kind of holistic analysis that you're naming, that understanding from the advocate perspective, really, of navigating the full context to those types of teams. I think that can be really, really valuable. So that is one of the recommendations, certainly, that has emerged here. But Greta, I don't know if you have anything to add from your experience navigating some of the reporting pieces.
Yeah, just to add that, so most of our information is, as Hema says, from media reports. And so it's really about like, are we catching them with the right, set of Google alerts, like honestly. But the other big kind of channel is really from you all. So we get calls or emails from membership saying, this incident just happened in our community. And so that's the kind of the other channel. Yep.
Greta, can I just add
Yes,
to what
please.
you and Hamer were saying?
Yeah.
I, you know, we look at data from a lot of communities throughout the country, and so this challenge is not unique to the state of Massachusetts. Many communities use the same approach that JDI is using. To Hema's point of needing a holistic approach, I think both are necessary, right? Media reports and law enforcement data, because neither one is going to get it right 100% of the time and be current and up to date. I've spoken with plenty of law enforcement officers who point out, just like Kelly was saying, we need to constantly monitor when we're presenting, unfortunately, what is the most recent homicide event. Law enforcement is kind of doing the same thing throughout their investigation. And what originally might not seem like an intimate partner violence related homicide, through the course of an investigation that can take many, many months, might subsequently be identified as one. So I think, a really strong approach to data collection would involve both.
Yeah, sorry, to piggyback on that, like I
Please.
think so many on this call, right? You run civilian police advocate programs, right? And it's kind of the same as when your advocates are reviewing police logs in the PDs that you're embedded in, right? That your family services teams, that the PD might be pretty good at identifying domestic violence incidences, but your civilian police advocates are going to be even better, right? They're going to say, these are not roommates. They just didn't want to disclose to you that they were partners, right? And so I think that, yeah, just to echo what Sarah, you're saying, like, I think it takes some of it would be even more community embedded nuance that would be really helpful to assess and to identify these incidences. And I want to just flag, Alex, I think you asked a similar question, so I don't know if you in the chat, I don't know if you feel it's answered, but any other suggestions for getting a unified way of reporting and unified language to ensure that we have a universal way of reporting the types of DV and methods and other metrics. So I don't know if maybe that's kind of the same question, but if there's anything else anyone wants to add on that. And then Sarah, I see your hand raised.
Hi, folks. Thank you, Kelly, and the Geiger Institute team. This is great. Thank you, JDI. I am curious, and this is probably a bigger conversation, but I will bump this up. I know there's been a lot of conversation about the Rule 14 criminal procedure updates that happened in about a year ago, and how that is impacting our local high-risk teams. It kind of felt like we were decimated for a while, and there's been some workarounds and some changed procedures, but I would love for us to take it up on a statewide level, to say, like, how do we deal with this effectively with meeting the spirit of that rule, which is important, but also still making our high-risk teams effective in this really important prevention mode. So I just toss it to you all to hope that we can take that up
Yeah.
as a field.
Very important, Sarah. Yeah, I'm so glad you raised that. We need to flag that and really have a conversation about that because I think uh, I got to look at some more myself. I would love to be in conversation with folks that are looking at it. I think there's going to have to be a carve out or something. I'm not sure what the solution is, but yeah, I'm glad
Yeah.
you flagged that.
Yeah.
Because if we can't understand it for ourselves, survivors are just going to not go to law enforcement, right?
Yeah.
Yeah, it's just going to be a deterrent.
Do you have another question in the chat? I think we can respond to it real quickly before we end. How would you suggest we get a unified way in reporting and unified language to ensure we, the Commonwealth, and the US have a universal way of reporting the type of DV and methods and other metrics like race, etc.?
Hmm. Good question. Sarah, that seems right up your alley. You want to take that?
I was just looking in the chat for the name of whomever put that in there because that question gets me so excited.
That's
It's a
our
million
friend from
dollar
the Mass
question.
Coalition to Prevent Gun Violence, I think.
Alex
I
Corrier.
love this. I love it. And I think it's unfortunate, but the opportunity is there for us to create a best practice around this because nothing exists in the country, unfortunately.
So let's do it.
I'm in. Sign me up.
And I think that really is kind of part of our next steps, right? To try to um, assess or gather data with these gaps in mind and try to fill them in and to think about how we can, yeah, use what we're learning to inform future prevention and intervention efforts, right? That's what it's all about. Thank you all so much, especially our team that I know has stayed on a few extra minutes. Thank you all for being here. We will share out the report, the slides, the recording, and let's keep this conversation going, as well as all those questions that and reflections that popped in the box and out loud. All right. And take care, everybody, on this sunny, allergy-filled day.
Thank you, interpreters.
Yes, thank you,
Thank you, everyone.
interpreters.
Thanks, everybody.